Good morning, everyone. My name is Matthew Raj. I'm a second year here at the University of Cincinnati studying medical sciences and Spanish. I'm on a pre-med track, but I have a really great interest in global health, and that's also started by reading about Dr. Paul Farmer. He's a medical anthropologist out of Harvard Medical School. He's done a lot of work, and perhaps we could consider him the man who would cure the world, and I'm really falling in love with the model that he has. So I'm here to talk about how he's been a hero for countless people around the world and how he's inspired me to continue this as well. So we'll start by talking how I got to know about Dr. Paul Farmer. There's a fantastic book called Mountains Beyond Mountains by Tracy Kidder. This book details Paul Farmer's upbringing, the adversities he's faced, his time at Harvard Medical School, where he would be taking classes as a medical student, but also flying down to Haiti on a constant basis to work with the people that he chose to work with. We'll talk about his work and his involvement with Haiti in a little bit, but this book, I cannot recommend it enough in terms of understanding where Dr. Farmer comes from, what his ideas entail, and it's a great stepping stone for learning about this form of global health work. So his organization that he formed with Dr. Jim Kim and Ophelia Dahl, who is the daughter of Roald Dahl, the author, the three of them were based. So Dr. Jim Kim and Dr. Farmer were students at Harvard Medical School together, the three of them forming Partners in Health, which started off in Haiti. We'll start by talking about Cange, Haiti. This is in the central plateau of Haiti, and it's an impoverished region. There's not a lot of support that comes from an already weak Haitian government. So the people here are perhaps the poorest of the poor. In an already underdeveloped country. You can see that lake underneath Cange, Haiti. That lake didn't exist before. It was formed after a hydroelectric dam was built in the area, but that lake displaced thousands of people who lived in the region who didn't quite know that it was happening to begin with. So these are the types of people who are living in this region, and this was the area that Dr. Farmer decided to spend his work in. He really fell in love with the Haitian people, and his Partners in Health organization has since started this network, this catchment area that covers pretty much the entirety of the central plateau of Haiti. There's tons of clinics and hospitals that they've set up. And his model is truly unique. He believes in the patient, and it's really inspiring to see the love that the Haitian people have for Dr. Paul Farmer. And his model, he's been using it to combat tuberculosis, HIV/AIDS, just a ton of ailments in this region. It's one in which he can even pay for people, or it's not enough to just have the drugs or the medical officials there to help out with a patient. What matters more is all of the circumstances behind a person's health and well-being, and Dr. Farmer realizes that and will offer money or offer any sort of support that a patient needs to become healthy. He's hired a whole team of local community health advocates that go and check in with his patients from all over the region, and he himself will make 6-hour treks to go check in on one patient, because that's the level of care and passion that he has for these patients, and it's truly inspiring to see that. And for me, his work ethic is incredible. He is spending countless hours writing emails, keeping up with donors, because funding is always a great issue when it comes to setting up a program like this, especially for the poorest of the poor. There was a lot of disagreement among his colleagues at Harvard Medical School, or even among global health workers. Why do we care about these people? Why are we investing so much money? Dr. Farmer would firmly reject that, and to me, that goes to show his heroism in caring for people who otherwise would have been forgotten in society. They've extended their work past Haiti to Peru. In Peru, their organization is known as Socios en Salud. Dr. Jim Kim was working here especially, and Peru for the longest time was seen as the leader in tuberculosis care, but Dr. Kim saw cases of multi-drug resistant tuberculosis coming back, especially in Caraballo, which is a slum outside of Lima, Peru. Again, the poorest of the poor in terms of the populations that they wanted to work on, but this is the population that they focused and cared about. Dr. Kim and Dr. Farmer started coming up with a regimen of very expensive drugs, but drugs that these patients needed to survive this new strain of multi-drug resistant tuberculosis. Nobody at the higher levels of global health would believe that this system would work or that the money was worth it, so they had to fight organizations like the World Health Organization to get support and funding for this. They were able to accomplish this, and Dr. Jim Kim is now president of the World Bank, for example. So these sorts of their work has been inspiring, and they've been using it in a couple of other countries. Their work has spread to over 10 countries now. They use that same model of tuberculosis in Russian prison systems where they were facing a huge outbreak of tuberculosis. Again, these are all stories that I'm sharing from Mountains Beyond Mountains, which is, again, a fantastic book. The way Tracy Kidder writes it is mixes the personal and the private of Dr. Farmer's life with the work that he's doing, and again, truly recommend reading that book. But it lets me talk a little bit about what this has meant to me. Again, I'm a second year, but here I am at the University of Cincinnati, and I'm looking to do global health work, or at least get involved. And so far, that looks like being a member of a student organization here on campus. It's called GlobeMed at UC. We're part of a larger network of other university chapters across the U.S. So there are over 60 GlobeMed chapters, and each of us are partnered with an organization, a grassroots nonprofit organization in the Asias, the Americas, Africa. These are organizations that are doing community health work much in the same model as Dr. Farmer. In fact, GlobeMed was inspired by Dr. Farmer's work. So it makes me happy to be able to follow in his footsteps, at least in a way. This summer I'll be going to Thailand as part of the GlobeMed student organization, and we're going to check out the work that our own partner is doing on the border between Burma and Thailand in support of Burmese migrants and refugees living in the area. They hold community health workshops, and there's a school that promotes education for Burmese migrants and their children. So it's a lot of cool work, and I'm really excited to go. And I'm really excited to see how learning about Dr. Farmer's work will inspire my future career in this field. I'll leave you all with one last a couple of suggestions. Of course, again, read that book if you're interested in learning more about Dr. Farmer. Bending the Arc is a documentary that was written about, or that was made for Partners in Health. I haven't seen it, but I'll probably watch it right after finishing this video. And then finally, if you're interested in joining GlobeMed or learning more about our mission, I'd highly suggest it. Thanks for your time, and I hope you have a great rest of your afternoon.